będzie mi łatwiej. Powiem 2 zdania jeszcze zanim może zaczniemy. Drodzy Państwo, czekamy jeszcze na pana doktora, który in a moment, sorry, I was switch into English. I can see, I think our panelist, no, he's not him, no. So we are waiting for one more panelist who is looking for our hall and join. Hello everyone, I warmly welcome you on our session, Vulnerable Groups in a Digital Age, the Strategies for Support and Promotion of Mental Health. My name is Dorota Kleszczewska, I'm representing Institute of Mother and Child in Warsaw, and I am very keen on the subject of today's session. I am a sociologist, I am health promotion specialist and public health specialist, and my field of interest, of scientific interest, is in mental health of adolescents, the determinants of it, including electronic media communication, as well as social behavioral change and social behavioral change intervention, including youth engagement elements. So I really warmly welcome not only experts, but also adolescents who are today with us. And today's session, I hope that we will have a very dynamic discussion. We have a lot of expertise around the table. And I would like to share this session for like 2 areas. Firstly, we will focus on general population of adolescents and try to answer and try to look carefully on determinants, but also on vulnerable groups among this general population. So we will try to answer the question, who are they? Are there any population among adolescents in general who are at the highest risk? And we will have a background, and have a choice to listen more carefully to the data that has already been presented at glance at the introduction and opening session, because it will be health behavior in school, your children, data on social media use and cyberbullying. So we will have the data at first, and later on I would like to focus on the groups who are vulnerable among the society and look carefully on them and try to think about them and their support, the challenges they face in the digital age. So firstly, I would like to warmly welcome our guests. I will start with the youngest, if you allow me to. So we have adolescents, Olga, Victoria, Magdalena, and Julia from Pultusk, from Piotr Skarga High School. And Anya, their teacher, and she takes care. And thank you very much for coming to the girls today with your input and contribution. Professor Bartosz Grabski, Jagiellonian University, so almost host of today's sessions. Dr. Anna Dzielska, Institute of Mother and Child, and Principal Investigator of HBSC Poland. We have Anna Król Jankowska from UNICEF Refugee Response Office, sorry, because the name is evaluating, so this is the one, proper one. Very warm welcome. We have Dr. Tomasz Trebnicki from Warsaw Medical University. Welcome, the psychologist as expert who will take and contribute to our today's discussion. And we have also Joanna Hajduk from Save the Children Foundation. Very welcome. And we have also another NGO, the Katarzyna Szymielewicz, the Panoptykon Foundation. Hello. And we have the International Villages, SOS Villages representatives, Lubos Tibensky, also welcome you. And I would like to ask Dr. Anna Dzielska to give us the background and start the discussion with data presentation.
Thank you very much. Good afternoon, ladies and gentlemen. I'm really pleased to be here and to show you some snapshots from HBSC study, which was conducted in 2021-2022, and it concerns young people who are growing up in a fast demanding world today. The world which is digital, which is shaped by social media, which is full of opportunities, but also full of risks and challenges, of course. So this presentation looks at how young people's emotional sensitivity makes them more affected to these challenges based on HBSC results. Oh, yeah. So during this presentation, I will share selected findings from the International Health Behavior in School-Age Children study, focusing on cyberbullying, on social media use, especially problematic use, and related aspects such as well-being indicators and body image. The data come from adolescents in Europe, Central Asia and Canada, with a special focus on Polish adolescents, and the results based on mainly on two international reports from this study, the report about peer violence and the second one about social media use, with some analysis conducted just on Polish sample. Before we look at the results, let's take a moment to understand what HBSC study is, because I think it's really important study. HBSC is the WHO supported study. Oh. It's a WHO supported study on adolescent health and health behavior, running since 1980s. It includes now over 50 countries and uses the same methods every 4 years. Poland has been a part of this study since 1980s, so almost from the beginning, and now we are planning the 10th round of on HBSC study in Poland. Here you can see the map with countries marked in blue, which are now a part of HBSC. The international data which we are collecting make it possible to compare health behaviors across countries over time and between different demographic groups, which make it crucial for understanding the broader context of adolescent health and well-being. The wealth of the data, the wealth of the data collected in HBSC survey serves more than just academic interests, because it serves also a basic information for policy and for practice. And now we will move to main HBSC results from 2021-2022, findings from the latest survey. First, we look on how young people in Poland use social media. Then we will explore the scale of cyberbullying, compare with other countries, with other peers, and we see which groups are at most risk. And finally, we briefly present selected results related to health outcomes which might be connected with using social media. Our first indicator presents problematic social media use, which we are defining as having at least 6 of 9 addiction symptoms which are associated with social media use. For example, preoccupation with social media, feeling unhappy without access to social media, experiencing negative emotions, etc. I will show you later the rank of all problems and frequency of choosing these problems by youth in Poland. On this slide, we can see the percentage of Polish adolescents comparing with average in HBSC. And we can see that problematic social media use is more common among girls. Girls are marked in green here on the graph. And we also can see that the most problematic age is the age of 13, and the group, of course, are girls. So more vulnerable group are 13-year-old girls. When it comes to comparison of data between 2019 and 2022, we observe an increase of problematic social media use, especially, again, among 13-year-old girls, and of course boys, but highest rise we can see among girls. On this chart you can see the rank of symptoms of problematic social media use, and we can see that it increases with age, of course. But I think that the main finding here is the most common issue that makes adolescents more prevalent to use social media, and this is using social media to escape negative feelings. So this is the most common symptom when using social media, but adolescents in Poland. We know that social media can positively support adolescents by helping them, for example, building relationships, nowadays express them creatively, for example, to access information, to engage them in social and civic activities. However, when it comes to problematic social media use, we can see that it's associated with a range of negative consequences. And here you can see that problematic social media use can negatively impact mental health, for example, can cause sleep disturbances, can weaken real social relationships, can also reduce academic performance and increase risky online behavior. One of the most serious risks related with social media use is definitely cyberbullying, both as something that they might do to others, but also they can experience, can be victims of. And this indicator shows the percentage of adolescents who reported being involved in cyberbullying at least once or twice in the past few months. The question we are asking is related to different forms of aggression, for example, sending offensive messages, posting harmful content, sharing images without permission. And we can see that international data shows that there are clear differences in the prevalence of cyberbullying, with boys more likely to report being perpetrator. And the highest rates are, again, observed among 13-year-olds. So again, we have this group as more vulnerable. And when we take a look at the international comparisons, so when we compare our children, our Polish children, with their peers from other countries, you can see that among those countries, Polish adolescents have the highest rates. For example, 11-year-olds ranks 7th in a 50 countries rank. 13-year-olds rank 4, and 15-year-olds rank 5th, which clearly shows that cyberbullying is a serious issue in Poland, especially around, again, the age of 13, when the behavior peaks. On this slide, you can see changes from 2018 to 2022 related with cyberbullying in cross-country comparison. As we can see, it has been a noticeable increase in self-reported perpetration, particularly among boys in all age group, and the same situation we can observe among Polish adolescents, when among boys cyberbullying increased in all age groups, and among girls the level stays the same or even decrease when it comes to 15-year-old girls. Next indicator is related in experiencing cyberbullying violence. As in the previous one, at least once or twice in the past few months. And internationally, we can see that 16% of adolescents experience cyberbullying in such frequency. And again, there is a difference between boys and girls, but this time girls more often experience this behavior than boys. And again, we have international comparison, and Polish adolescents at the on highest levels of experiencing cyberbullying. For example, among 13-year-olds, there is about 30% of girls and 25% of boys who experience cyberbullying. When it comes to experiencing cyberbullying, we also see increase from 2018 to 2022, but in all age groups and both gender, with the exception of 15-year-old girls when the trend was stable. And the same we can see in Poland. The share of adolescents experiencing cyberbullying increased between 2019 and 2022, especially among younger children, so 11 and 13-year-olds, and especially among girls. As I mentioned earlier, cyberbullying is just one of threats to health and well-being of children and adolescents. And in the literature, we have a wide range of risks related to social media use. For example, related to mental health. And with next two slides, I wanted to show you examples of, again, ranks of some indicators of mental health and related aspects like body image in Poland in comparison to other countries. So we can see here how Polish teens compare to their peers in other countries. They are too fat. So we can see that, unfortunately, across all groups, Poland is on the top of the list. This is, of course, worrying, especially because body image is strongly related with self-esteem, with mental health. And we know that the most important thing related with that issue can be social media and the constant exposure on realistic body standards, beauty standards which adolescents observe in social media, and which can make young people feel worse about themselves. And another example, the last one. On this slide, you can show the average mental health well-being score based on WHO-5. And again, Poland is right at the bottom across all age groups. That means that our young people report the lowest level of well-being compared to their peers in Europe. And again, it's a signal for us to do something. Because we are collecting this data, as I told you, since 1890s. And we have results like this from 3 or maybe 4 runs. So we know that the situation is not good. And I think that this is a moment to do something with this based on evidence we have. And definitely we have to pay attention to this developmentally vulnerable group, which are adolescents, especially younger adolescents, which are the most at risk, as we saw. It's just an example what to do, what can be done, what we need to do to improve the situation, and this is related with this digital issues. Of course, we need multi-level approach because we know that digital skills are not luxury in nowadays. They are basic skills in 21st century, so that we have to equip adolescents with such skills like critical thinking, like media literacy, which can help them navigate the online world more safely and more confidently, and we have to create a more secure digital environment to minimize the risk of harmful content, for example, of cyberbullying and unrealistic body standards, of course. And finally, collaboration is a key. So this is something we are fighting for from years. Collaboration between all sectors, policymakers, educators, parents, between experts, but also tech industry, and including the voice of youth. Thank you very much.
Thank you very much. And this is very interesting. We can see the sample of international adolescent sample, but we, of course, today we are discussing the European Union approach, and the adolescents from European Union area we mainly focus today. But I think that Polish case, the case study of the group, is very interesting. Yes, because this is very alarming, and let's say we are wondering, probably all of us, as we can see, and we are mainly aware of the situation, that we are at this most negative, let's say, rank, or the top of the mostly negative ranks. And the question is why? Yes? So we have the Poles as the mostly vulnerable group, I would say, after this presentation, in some indicators. But of course, we have heard about 13 years old, we have heard about girls and body image, and I wonder if we may, because of course it was a cross study, so this is only a glance, yes, that we can only see the picture, the very broad one. And if we would like to go more into details, I will ask probably psychologist's approach. And I look at Dr. Tomasz Srebnicki, who works with adolescents closely, one-on-ones probably, or smaller groups. And what could you tell us about this? Why the situation looks like that? And do you confirm the comments on the insight from this big data picture?
Thank you for the question. I 100% agree with the results of the study. This is what we observe in our everyday practice as well. And from psychiatric and psychological point of view, we may say that mental illnesses are caused by many factors, like family factors, genetic factors, environmental factors, but we don't pay too much attention on what I personally call digital exploitation. So when we think about, I'm not talking about exploitation or the way we think about exploitation, for example, sexual exploitation. I think about ways that social media addresses the needs of children and adolescents. And for me, this is one of the main contributors right now to deteriorating mental health of children and adolescents. When we look at what they do, actually, I don't want to sound paranoid, but to some extent, what they do is they exploit emotionally the needs of our children. So what they do is they address their functioning on a level which cannot be critically, you can't think critically about it. So when you look at the ways they do it, they do it by using unconscious learning mechanisms and exploitation of basic needs of children. And when you look at the mechanisms, the basic mechanisms are variable reward mechanisms, and they are similar to gambling mechanisms, and which we cannot address to a large extent. We also have social validation metrics, so likes, followers, shares. And what's most important is algorithmic content delivery. So from an emotional point of view of a youth, of an adolescent, this is, I think, brand new thing when we think of humankind, the development of humankind. What they are delivered with emotions. They don't create emotions. In order to to make them use social media, the main interest is on creating emotions. That's why so many of them report feelings of loneliness, emotional dysregulation, and also there's a huge amount of children who claim not to feel any emotions. This is because in order to keep them engaged in the screens, they have to be provided with emotions. So the emotional creativity that we are all used to, that we were all used to throughout generations, is hampered. And that leads to them being unable to create social emotions, to create their own experiences, which may be boring, which may be disappointing, but they are delivered with emotions. And on every level. They are delivered with sadness, they are delivered with anger, they are delivered with disappointment, with competition. The body image is the perfect example. And this keeps them stick to the screens. And what I hate most about it is the scrolling issue. The one who came up with the scrolling idea, which is similar to gambling, which is similar to gambling. It's a hellishly good idea. It's an invention of a devil, right? Scrolling gives you continual rewards. And what they also do is they bypass natural stopping cues. So there's lots of infinite autoplay. So a normal person outside the world, outside the digital world, where a normal person would make a stop. The stop is skipped in digital world. So there is sort of autoplay, which makes you not rest all the time. That's why we have sleep disturbances. What's also important is the experiences that they have on the internet. As policies, we often tell them that they should develop critical thinking. It's a great idea to be critical. It's a great idea to be aware of many things. But the issue is that in most cases, what they experience cannot be processed by them. So once they get a slap, they can't do anything about it. It's so intense, it's so concentrated that you can't use what we call coping mechanisms, compensatory mechanisms, or defense mechanisms to deal with the stress or with the extreme joy that they are presented with. So that leads to them having issues with their identity, with their emotions, and with their self-esteem, with their anxiety, and so basically with their emotions, with their feeling of self-worth, self-esteem, self-driven behaviors. And from clinical point of view, I don't know, there's too much we can do about it. I don't want to sound paranoid, but as long as we keep these technologies cheap basically, affordable, as long as we keep these tools accessible, so cheap, as long as the producers of software developers or those who manufacture these tools will be interested in us using them, and are not interested in our well-being. They're interested in making money, making profit, so that they will use all the means possible. Awareness is great, but I think we should come back to what we always do in our psychiatry unit and in other units around the world. We need to come back to family. We need to come back to addressing small communities. And we need to come back to what used to work and was destroyed. So this is my postulate. Thank you.
Thank you very much. It's very, very huge struggle in front of us, and it's unfair game, let's say. And of course, we are talking about youth engagement, but it's all about engagement, but not in a positive way. And of course, we today would like to, probably, because we know that it's very difficult. We are looking for some conclusions, some strategies, some call to actions, because we need to do something, and as Dr. Cielska mentioned before, that we know it from several years, yes, and it's decreasing and decreasing, and the use is increasing, yes, and let's say the technology are also evolving. And now I'm looking to Katarzyna Szymilewicz, who is the expert of legislative point of view, but also maybe tell us a little bit, because we are here from the health scientists mainly, but we would like to know a little bit about this addictive mechanism, and Katarzyna is also with her foundation working on this ground. So Kasia, voice to you.
Thank you. I'm speaking without microphone.
No, please, we have only 2 hours. We need to share.
Thank you, and I'm very happy to be the second commenting person, so I don't have to go back to the basics. Thank you for framing this so well and giving it the right name. I'm a lawyer by background. My organization mainly works on the legal front, so we try to regulate technology to address these problems. And I can reassure you that this is not ignored. Of course, not so much in our country, and for good reasons, because this technology is global, not even European. So we have to tackle these problems at least at the EU level. And this is where this is happening. For the last 5 years, in the last 5 years, we have seen incredible inflation, even some say, of these regulations targeting large online platforms. We, as the movement of organizations, of course not just Panopticon, but Panopticon among many others, fought for solutions addressing these problems. And as always with lawmaking, we reached compromise, which is somehow rotten from our perspective, but we are facing the wealthiest, the most aggressive companies. I'm sure I don't have to teach you about how lobbying and big politics works, and capitalism. This is the essential enemy here. Exploitation of our attention and data is allowed and happens because it makes money. It's simple as that. And we are being exploited because our attention, our data translate into somebody else's profit. I mean, if anxiety in kids, if addiction in kids wasn't profitable, if disinformation wasn't profitable, it wouldn't be there, I can reassure you. It's there because it makes profits. And we have to be very clear about it, because if we don't make these big political stakes clear, we are fighting the wrong battle. An example of a misguided battle can be disinformation. Disinformation, of course, is a weapon. It's a weapon during war times, cognitive war as well. But it's not like rain, falling on us. It comes from somewhere. Somebody's funding it. It's there for a reason. And the reason why all the policymakers, even big companies, if you look at them, like funding, fact-checking initiatives and all that, is that they know it's not addressing the very essence of their business model, which is to produce this information. Same here. We can spend all our lives tackling the results that you, psychologists, psychiatrists, see, and it's amazing, wonderful, and I'm grateful for you for doing that. But you cannot clean the internet. You can't clean what has been produced there in kids' minds, right? This is not the sort of job that we can take as society and just let the business continue as usual. We have to go back to the roots of this problem if we want to stop this epidemic that healthcare has to face. And here are, if you ask me for reasons, of course they go back to business, to the money-making machine. So those who design these large platforms and those who profit should be the first ones responsible. Already quite a few patterns of design have been mentioned. I can only add a few examples we've been looking at. Engagement-based logic of algorithms that curate content. I'm sure you all know it. What things we see on our screen, they don't get there by coincidence, right?
Kasia, could you focus on children? Yes,
on children. It's all these mechanisms. They are the same for.
Yes, and it's also about this 13 years old, because we know that we need to give a date of birth, and it's usually the border is 13 years old. So we have seen on the data 11 years old using social media, and according to the legacy, yes, it's illegal, I would say. So are there adolescents under 13 in the internet, and Do we know it, or we just need to ask adolescents themselves, or we can see that somewhere else?
Yes, of course, there are young kids online. It's not me who've been doing this research. You have seen this research, I believe, today presented by Marta from Instytut Cyfrowego Obywatelstwa. They did recently, together with a couple of other big players, online research confirming the scale. It's, if I remember correctly, what they were showing, it's 1.3 million young users who should not be there at all and who are there. So this is obvious fact for the industry. Industry knows it very well. The same algorithms that curate content for us, they also do behavior profiling. So from the perspective of those who show content to the user, that's how they call us for reasons, you know, they treat us as addicted ones and people who just get exploited not as clients. So that's why they keep using that term. They know very well that there are kids on the other side. The question is how to regulate that effectively. So the mechanisms I wanted to describe, they apply to everybody online, both adults and kids, and I like it this way. I mean, we oppose ideas of doing different levels of protection for kids and adults, because adults also can be vulnerable. Kids should not be online at all in some places. And if they go there, yes, there might be special mechanisms, but this is a trap. I mean, this is the solution described in this book, among other solutions, to do the special design for kids. This book is criticized for the reason that the author, Joanna Hajduk, is quite close to Mark Zuckerberg, and there are reasons to think that even him being critical academic, describing the crisis of mental health, he ends up proposing something very comfortable for Silicon Valley because they pay for this research. It's very easy for them to get away with, we don't sell drugs to kids below 13, okay? Just let us do that to adults and everything will be fine. No, we have to pull a hard stop on addictive design practices for everybody, because everybody can get vulnerable and exploited. Kids more than others, but we shall never give them away.
Yes, we have heard earlier that parents, we are also addicted to
and we are modeling the kids' behavior. So I'm against treating kids as the only target of regulation, also because in the law, all that is prohibited. Right, dear audience? I mean, I'm sure you know it. If not, let me reassure you, this is all illegal. It should disappear like this if we get the law enforced. Why this is not disappearing? I mean,
especially
come on.
that technology,
it's like crime,
as you mentioned, could allow us to remove the children from the net. Yes, under 13, under 11, and
social networking spaces could be designed in almost positive way. Some of us, the older ones, remember internet that was not based on algorithms that curate experience to make us addicted, enraged, hateful, depressed, and anxious. Some of us remember internet that was more social. I know spaces like this because I know people who design spaces like this as an alternative. These are tools. It's like wood. You can really build stuff with it. But the way so-called social networking sites have been developed in last 2 decades, it's precisely against human. And I'm not the best one here to explain it because I'm not a psychologist, but there's so much research. I'm just looking at the paper that we are concluding today with KGI, a Knight Georgetown Institute, which combines academic researchers and policy people like myself in the US. Together we do submission for European Commission. Today is the deadline to submit evidence in their most recent call on this issue. It's 30 pages of research we quote, we don't do it. We have vast knowledge about how toxic and harmful that is. It's like this for reasons, and we can redesign it. But if we just keep, missing the source of the problem and saying kids should leave these spaces, parents should not give them phones, school should ban phones, blah, blah, blah. We are just addressing not even side effects of a problem that has been designed and created for a reason, which is profit-making. So it's like with unhealthy food, it's like with illegal drugs, it's like with hard drugs or alcohol or nicotine. We have to call it what it is and demand good design, which is absolutely possible and doable, also for kids.
Thank you very much. Yes. Yes, of course. Yes, yes, please. Of course.
Okay, thank you. I just just wanted for 1 second. I'm also from UNICEF with Król Jankowska, so I'm really focusing my work on children. And as I heard you speak that we should treat this problem as a whole and to address also adults, I fully agree. Although I am treating children as a vulnerable group, which makes me feel that we should pay extra attention to how we address it. Because as you were comparing it also to eating habits, for example, when it comes to children, we also say something about first 1,000 days. So first 1,000 days of child's life, we should focus on the way they choose nutrients, what food we propose to them, they decide how much of it to eat and so on. But we are responsible for their well-being. So as I agree that we should formulate laws and push for regulations that address the problem in general, we should really remember that this is the vulnerable group that we are responsible of as adults. That this is the future of our society and that their cognitive development is not in the same moment as ours adults when it comes to screens and so on. So
thank you very much. This is probably interdisciplinary attitude, yes, and we should involve all. I am also like health education specialist, so I also think that we should put on this social behavioral change also together with legalization law and looking very carefully on the technology we are fighting with.
Maybe it's important to clarify that the laws I described already exist and they already do what you're asking for. So we have baseline for everybody and we have special protections for kids. They are treated as vulnerable as they are. We have all this in the law. I'm just saying why this is not enforced. That, you know, we go back to the business model.
On the other hand, we have also adult parents, just not from the evidence-based research, but from the background and my daughter's classroom. They allowed to put the date of the birth, the full one. Yes, so that you seem to have 13 if you are 10. Yeah. Yes, and you have the access. So if we do something, this is illegal, yes? And this is, for me, in my discussion, it was very helpful that I said, but this is illegal. I cannot do this because the law is against that. I can allow you to do the same. Yes, so it's a bit handy or some argument that we also have, but also agreed that we have to fight also with the technology because otherwise we will probably fall, and we are now failing, yes? And now I would like to ask, because we have the case also from abroad, Lubos Tibensky, and you were also having the project on cyberbullying. So we will come back a little bit to that topic, and please introduce your experiences and also your insights to the discussion that we are having here.
Thank you very much for inviting SOS Children's Villages to this discussion. We are an NGO that is supporting children that are at risk of losing parental care or already lost it in 136 countries, and out of that 22 EU member states. We have some specific topics maybe later to this target group, but I would like to mention a project that was done with the help of 5 SOS Children's Villages organizations from 5 EU member states that was in general addressing peer violence. It was called Applying Safe Behaviors. And the idea was that there was a scoping at the beginning, asking professionals working with young people, as well as the young people themselves, what are the main topics around peer violence for them. And the answers show that 1 in 4 professionals were saying that they didn't receive enough information about peer violence, and this included also the cyber bullying. And the young people, they said that basically they would like adults to act as role models when it comes to you know, accepting differences and showing positive example and inclusion. At the same time, they say they need spaces where they can discuss and learn about what is it peer-to-peer violence, because sometimes it's very hard to distinguish what is, you know, peer contact and what is already a violence. So within the project, peer-to-peer methodology was developed so that young people themselves can teach and discuss with their peers in schools.
It was international project on the...
Yes, there was five EU countries involved, and also a training for professionals so that they are able to support young people better. And of course, and something that young people really kind of raised was that they need trusted adults, because whatever happens online, the help is kind of in the offline world. So the young people have to trust in general to their parents, to their teachers, so that they go and ask for support. So I would like to bridge a little bit this project to child and youth participation. I see the young people here, and I'm looking forward to hear from you. Because in SS Children's Villages, we really focus on youth participation. We are a partner in implementation of the we are a partner in implementation of the EU Children's Participation Platform as part of the European Commission's realization of the strategy on the rights of the child. And for this year and the next year, mental health of children, as well as the digital space and kind of these intersections between them are very high on the agenda. So this will be the priorities. So we really want to kind of see how the member states and international organizations kind of use the consultation of the young people on these topics.
Thank you very much, and completely agree that without youth and youth engagement, we cannot change youth world and youth literacy and digital literacy. So now I will give the voice to girls from Pultusk, and you can share the experience, your experience yourselves, and of course your peers from Pultusk, but you are also having the voices gathered from the European countries and even among from 44 countries, so even broader area than only European Union. So we are looking forward to that.
With the rise of technology and social media, teenagers are spending more time online than ever before. It is well known that the internet offers many opportunities, but we can't forget that at the same time, it opens the door to dangerous and harmful behaviors, especially cyberbullying. This specific type of bullying doesn't stop after leaving school when the bell rings. It follows students into their homes, minds, never leaving their side. Let me start with the fact that unlike face-to-face bullying, cyberbullying can be anonymous, which makes it harder to stop. With just a single, cruel message, photo, or any other hurtful online activity, it's possible to seriously damage someone's mental health. Victims often feel helpless and embarrassed. They think that their whole world ended and that there is nothing more to do about it because it happened in the digital world. Many cases of cyberbullying end up with suffering from anxiety, depression, but in extreme situations, it can also lead to suicide. Imagine being a teenager, already struggling with finding a place, your place on earth, and then constantly being attacked, judged, and humiliated online. To make matters worse, it's truly heartbreaking how easy it is for the bully to hide behind the screen. They have various ways of masking themselves. For example, they can use fake accounts, anonymous messages, or private groups, which makes it even harder to trace. As a result, many victims feel powerless and are afraid to speak up. The topic of cyberbullying is really well explained in the Netflix series Adolescents, involving two 13-year-old characters, Jamie Miller and Katie Leonard. A private photo of Katie is non-consensually shared among classmates on Snapchat. Jamie thought that it was his only chance of asking Katie on a date, so he tried while she was vulnerable. Unfortunately, the girl rejects him and later mocks him by using an emoji as a code to call him an incel on Instagram. The public humiliation deeply affects Jamie, which contributes to a tragic escalation of events. This shows how digital harassment can lead to devastating real-world consequences. As I mentioned, emojis can be used as codes amongst teenagers. I'm going to give you some examples. The half-red, half-yellow pill emoji symbolizes the concept of awakening to the truth about gender dynamics, often associated with misogynistic beliefs. The 100 emoji relates to the 80-20 rule, suggesting that 80% of women are interested in only 20% of men. And of course, each color of a heart emoji represents different levels of romantic or sexual affection. For example, the red heart emoji symbolizes love, but the yellow heart emoji asks a question: are you interested? It's necessary for parents to be aware of these symbols and to monitor their children's online interactions. But here's the truth. All of this can be prevented. Schools need stronger anti-bullying policies. Social media platforms must take responsibility and act faster against harmful content. And most importantly, we, students, adolescents, need to support one another and speak up when we see something wrong. It is important that the victims know that they are not alone and that they can ask for help. Cyberbullying is not just a problem on our screens, it's a problem in our lives, but we can fight it. It starts with awareness, grows with education, and succeeds when we all take responsibility for our actions online. To sum it up, we should never neglect the impact of cyberbullying, and we should teach young people to use the internet responsibly. Thank you.
Thank you very much. We can hear the very strong voice of you. This is like in line with the girls from Gdynia who were presenting at the opening session today. This, I think, impacts us here very, very strongly. So I think this is also the clue, to listen to young people, because we then listen to them very, very carefully. Much more, we are much more focused than when we talk to each other. So girls, very, very thank you for that, for coming. And do you have anything to add about this international quotes? Because we can see it here. If you would like to have something to add. Oh, okay, so this is only about that. I can sum up it with that on one hand we are fighting with technology and those mechanism, algorithms, but on the other side we are of course fighting with us all and the ones who are putting the content into the net, yes, because it's also all about the content and we put it somewhere there, or we make search, and then we are in this bubble and cannot get out. And do you have any thoughts, any comments? Now is the time to have a discussion. If not, we will move to the other part of our panel session, the vulnerable group, and the UNICEF presentation on the children from the refugee backgrounds, but also the digital hygiene project and intervention that you are proceeding internationally. So, Anna Król Jankowska.
Thank you, Dorota. Will you help me to change the slides? Dorota, will you help me to change the slides while I'm talking? Yes, you have the pilot there. Remote is there, yeah. But before I will go to actually refugee populations, I wanted to comment on Victoria because I've seen this movie. And what strikes me the most was the conversations between the parents actually who claim that the son, the James, he came back every day from school, closed himself in the room for the 8 hours, and the parents had no idea what he's doing there. So when we are talking about the holistic approach and including actually in adults and children's lives, I wanted to show you, Dorota, if you could, can you just switch for the third slide? Yeah, one more. Thank you so much. I don't want to bother you with the statistics because it has been already provided today, including that the suicide is one of the leading cause of deaths among adolescents. But what I wanted to show you is the fact that 1 in 5 children worldwide live with a parent, caregiver, who has a mental health problem. So now, how can we actually help kids if we ourselves, being the parents, have such an enormous, huge mental health issues, which is more than 20%, correct? And here you can see that without early intervention, children and young people are at risk of ongoing or recurrent mental health conditions into the adulthood, including the substance use disorders or even Alzheimer, which is devastating. And the effects of unrecognized and not treated mental health conditions can have the fatal consequences, including suicides, which has been already told today. But when we talk about the digital technology, what is important to say is that globally, 1/3 of children and youth are online. Yeah, I'm sorry, I wasn't changing the slides. Yes, it's here. And almost 100% of young people in the EU are accessing the internet daily. At the same time, 95% of young people agree that they are easily finding information on the internet, but at the same time, 1/3 of children do not agree if they can tell if the website is even trustworthy. At the same time, almost 5% of kids had experienced unwanted sexual requests at least once a month, 70% saw harmful content online, 14% experienced virus or spyware, and 10% had experienced online bullying victimizations. Also, from the other point of view, the highest average life satisfaction of children, according to time they spend in front of the computer, is less than 2 hours. Thank you, Dorota. 2 hours per day. And coming now to the next one, the national context, I want to tell you that as the UNICEF Refugee Response Office, we can say that as of January 2025, more than 990,000 Ukrainian refugees remain registered in Poland, out of which 37% are actually children. And we know that war is only enlarging the problem of mental health issues. And as UNICEF, we have reached more than 810,000 children and caregivers through different mental health services and psychosocial support services. The next slide. Yes, thank you. As the UNICEF, we not only delivering services, but we are also conducting research, including randomized control trials. And as you can see on the first slide, it's the digital realities of refugee population in Poland are quite alarming. As UNICEF, we have conducted a couple of research, including how the digital realities are being perceived by refugee populations. And you can see that children attending online Ukrainian schools share mostly negative perceptions of their digital experience here in Poland. They describe fatigue from prolonged screen time and frustrations with what they saw as disorganized classes. Many of them still have limited access to digital tools caused by unstable Wi-Fi connections, and they often report feeling disconnected from both Polish school communities and their online Ukrainian peers, and many, like Dr. Say, spoke about the loneliness, especially during the first months of visits in Poland. And here's the other research that has been done by our social and behavioral change specialist. It was conducted online and dedicated for 16-19 years old. And we explored how youth perceive and engage with mental health and psychosocial support services. And through the focus group discussions that they were conducted, we revealed that introverted adolescents often actually prefer online sessions for the sake of their privacy. But at the same time, look at the numbers. 70% of respondents, so Ukrainian youth, are not currently using any MHBSS services, while 80% of them agree that integrating this type of services into their lives would actually improve their well-being. At the same time, half of them indicated the need to actually seek mental health support services. And among those currently accessing services, the most common one, among others, the online counseling. We have also developed a randomized control trial where we are trying to see what type of short-form videos are mostly preferred by this group of people, and the most effective message turned out to be the one delivered actually by peers to peers. And it was one including social norm message. We have together here, we have the social behavioral change specialist. She can talk about this more. And now the next slide, I would like to show you 4 examples of digital strategies that UNICEF RRO office in Poland has implemented recently. And the first one is actually the podcast Spotify. It was launched in 2023 to support the mental health of both Polish and Ukrainian children. We promoted it via Spilno social media channels, and altogether the podcast gathered over 140,000 plays in only first quarter of 2024 with episode 1, Let's Talk About Mental Health, leading the popularity. I all very much encourage you to listen to this podcast. I listen to, although I'm not youth anymore, I'm also listening this on a daily basis while traveling actually to work and struggling with some hard time. And the other example is the Accessible School for All. This is the program that was developed together with the National Research Institute and the Ministry of the National Education. It's mostly the digital platform that offers and equips school psychologists and other specialists with skills in early diagnosis and crisis interventions. With the tools available there, you can strengthen the mental health support, prevent crisis, providing target assistance to students, parents, and educators, especially those with migration and refugee experience. And this is also connected to another platform, e-learning platform called Learning Passport. It is also available to everyone. It was together created by UNICEF and the Microsoft. It's a free e-learning a platform supporting inclusive education for refugee children and their teachers, and it was also recognized by the Ministry of Education in Poland. You can find their training modules on mental health, on psychosocial support, inclusive teaching strategies, and helping teachers manage stress and create a good classroom environment, inclusive for all. And the last but not least is it's the youth support, which is the mobile and desktop application. We are launching this year, 2025, to promote mental well-being among Ukrainian refugees and Poles, which are aged 16 to 24. Each of the users is actually aligned to free consultations online, to many self-help resources, including practical guides on topics such as stress management, anxiety, or even relationships. And also there is a huge question and answer forum where you can use the peer support and connect online, which is also highly recommended by us. So that's it from my side, but if you have any more questions, we have here the education specialists and like I say, SBC specialists, so we are happy to talk further as well. But thank you for your attention.
Thank you, Ania, and thank you, UNICEF, because the Refugee Response Office, together with Social Behavior Change Office, are doing a lot in Poland, especially after war in Ukraine began. And we need to all be aware that we have Ukrainian adolescents here in Poland, thousands of them, and they have been learning or they have been participating at school remotely. So we remember all the COVID situation when our kids were 1 year almost online, and it's 3 years now, and they are mostly in remote schooling. From the 1st September 2024, there is the obligatory law for them, for adolescents to participate, to children and adolescents to participate, to go to Polish school. And we also need to focus on that group, because this is for sure vulnerable group, which is in our society together with our children. They need to cooperate, they need to build strong bridges, and we probably need to, and for sure we need to support it. And thank you for providing such tools as Anya mentioned. We will for sure all focus on that and look at that with interest. But we are now in the vulnerable group part. So we look at the group who are at the risk of exclusion and at the high risk of cyberbullying, and the special attitude needed in the digital age. So I'm looking at Professor Grabski, and I would like to give the voice to you.
Hello again. I am actually a psychiatrist and sexologist who clinically and also academically, scientifically specializes in LGBT health. So LGBT group is a vulnerable group within already vulnerable group, which is general youth and adolescents. And there is a lot of I could say on the topic, and I have some inspirations coming from this panel. One of the inspirations is a kind of insight into the paradox that we have. LGBT people has always been looking for safe spaces. Safe spaces were very, very important to find people who are like we are, if we are an LGBT individual, to be able to meet them, to be able to socialize, not to be the only gay in a village, as the famous saying said. So finding these spaces were of crucial importance for safe development. And the paradox is that internet and online communities became such a seemingly safe space, and we need to be aware that for LGBT individuals, it is still internet generally the source of many resources. Actually, so I can meet people who are exactly as myself. I can structure my experiences so I can realize I'm not alone, my experiences are valid, are healthy, normal. You can feel the way I can feel. So it's the source of different kind of support, like emotional support, like informational support. So you can get access to knowledge, to information, where to go, what to do, etc. So resources are there as well. But what I think is now it might have been missed is that internet is also a source of different threats and exclusion. What, from my perspective, I would point to false or to misinformation, which is, in my opinion, a very dangerous aspect of internet. When you are a young LGBT person, you seek out, you look for valid information. When you grew up or when you grow up in a unsupportive environment, you probably will internalize different negative attitudes, beliefs about LGBT people, half-truths, stereotypes, false statements. So I think it's very important what kind of information you will meet. In a most, how to say, positive scenario, it would be good that the internet and online environment would be a source of information which could counteract all the bullshit you can meet about, for example, being a deviant or being a threat to children when you grow up, when you are a gay guy who is now 15, or about transgender identity being, a result of some psychopathological processes. To crown it all, the LGBT issue, especially trans issue, has been involved in political struggles in the last years. So it makes this environment even more threatening to the well-being of this population. So one threat is this false information, and of course cyberbullying, which was mentioned as well. So it's pretty prevalent. It's also prevalent in LGBT in individuals. So in the internet space, LGBT individuals will meet exactly what they used to meet or still meet in their real lives. So name calling, threats to physical safety, to say threats to dignity, mocking, also false information. All, for example, revealing one's gender identity or sexual identity, revealing one's messages sent to believed to be friends, people, with revealing who a person actually is. And a lot of things were also mentioned. The mental health, for example, of course, LGBT population is in the risk of developing the whole spectrum of problems due to what we call the minority stress. Just to remind you of the model, of the theory, it's minority stress is the additional stress that minorities, people from stigmatized groups experience. It has the distal aspect parts, which are, for example, aggression, external aggression, like cyberbullying, but it has also internalized parts, which are so-called proximal stressors, like internalized transphobia, homophobia, living in concealment, expectation of rejection. And we all know that these processes, both the external and internal, will lead to health problems. Mental health problems like anxiety, depression, substance abuse, eating disorders, for example, as well. Somatic problems, possibly like diabetes, and behavioral problems like out-of-control sexual behaviors or unprotected sex. So it really influences lives. And one more thing, for example, eating problems or body image. It's a universal and at the same time very specific problem to LGBT population. Imagine those false images, hyper, beautiful, hyper, correct bodies. For a young gay boy, for example, who, grows up into a subsegment of the gay community, which is very, body-oriented. Or a young trans person with gender dysphoria, which already struggles with body image. So confronting with these unrealistic, presentations, for example, it's an example of interaction between what is universal and also specific for the group. And I don't want to prolong, just wanted to say that we should still remember, the problem of LGBT people and youth is not closed. And maybe the last thing to say, that so-called coming out and identity formation, it's actually the period of life we are talking about. The most vulnerable part when you internalize, norms and beliefs, and which is why I think this population needs very special attention. Thank you.
Thank you very much. We need to speed up a little bit. That's why I will give my voice to Joanna Hajduk, and she will present also the project of Save the Children organization. We have one more, I think, microphone over there. Yes?
Yes, hello, my name is Joanna Hajduk. I'm representing Save the Children Foundation. And I just wanted to present some programs of our foundations that focus on the, I would say, protective factors. But before, maybe I will say a few words about our organization. So I would say that we are the world's leading independent children's organizations working in more than 100 countries and focusing on different topics such as healthy start in life with our healthcare programs and nutrition programs, focusing on quality learning. We have a strong education sector as well as a child protection sector, because we are also focusing on childhood free from violence. So, and also tackling the subject of climate crisis and other emergencies. So trying to address holistically different challenges of the modern world. And I destroyed something? No. Okay. So we have the child protection, education and MHPSS sectors here in Poland, and trying to work holistically to reach also the areas that are not very much, accessible. We are, for example, working in alternative care centers for children from Ukraine, evacuated from Ukraine, that are in remote areas. We are trying to work in a very inclusive and participatory manner as well, so including children's voices in our work, and also advocating to protect their rights, raise awareness, and drive positive change. So let me just show a few numbers. So till now, during those 3 years of our presence in Poland, because we came here with the Ukrainian war crisis, it marks our, start of operating in Poland in the first days of the war. So we have reached more than 174,000. The right number. I'm checking with my colleague here. I'm not good at numbers. So, as you can see, we tried to cover the whole country, of course, in very different, sectors. Not in whole the Poland we could address all the problems, of course, but we are trying to be everywhere. But today I wanted to to talk a little bit on the Ukrainian refugee children and the programs that we prepared for them. But before, let me quote some reports. One of them was already mentioned by Ania from UNICEF. So the report, it's school here, no doubt about it, but home is home. So this report stressed the loneliness of the children, and that the fact that they do feel a lot of difficulties to create relations. They also feel discriminated. The concept of compassion fatigue. We are not very much happy, I don't know, and to see Ukrainian people, of course we are, but a lot of people are reacting in a way that they do not feel welcomed anymore. and it really, it is a strong, you know, I would say, risk factor for the mental health of children and youth. Another report we have took part in was the out-of-school report, assessment on barriers to school enrollment for Ukrainian refugee adolescents in Poland. We already mentioned this subject as well. Most of them were learning in online schools, really tired about it. And now they are, most of them are learning in Polish schools and in online Ukrainian schools. So you can imagine the overwhelming reality. And also this report highlighted this negative impact of being online, not connecting to peers, feeling lonely and isolated. Another report I wanted to mention is tackled another type of vulnerable population that we have here in Poland, smaller one, and I'm talking about people who came through Belarusian border into Poland, and about people who are in the centers for foreigners, closed ones or open ones. It depends, of course, on the situation of the person. And we also prepared a report on psychological support that is offered in those facilities that is highly insufficient. So in our programs, we also try to tackle this population as well. So these are the 3 reports we based on. Of course, we had more of them, but focusing on protective factors was our decision to support children and youth on this second level of this MHPSS, which means, of course, mental health and psychosocial support pyramid. I'm sure you are probably you know this scheme, but just to remember that. And now I remember our conversation, Dr. Tomasz from Rzeszów, from the other conference, when we were talking about the lack of specialists. Yes, this is when we are talking about mental health issues in Poland. You probably will hear that the most important problem is the lack of specialized care. But we know also that it's true, of course, but many children who are in need of those specialized care wouldn't be there, you know, at this very top of the pyramid if they had been supported on the lower levels of the pyramid. So by families, by communities, by schools, by peers, and of course their basic needs were fulfilled. So we deliberately decided to focus on supporting on the second level of the pyramid. And I think, honestly, that this is something that is lacking the most in this country. Of course, the specialists. Of course, we need more psychiatrists, children psychiatrists. But we do need more of effort and willingness to act and to invest in those second-level interventions. So our programs in Poland focused, our MHPSS program in Poland focused on this second level, and we supported children in alternative care, as I have mentioned before, in evacuated centers from institutional care in Ukraine. So we created child-friendly spaces with MHPSS support. Also case management program, which means that case workers worked individually with children, trying to assess their needs and fulfill them, of course, with caregivers' support. And we also provided individual psychological support to children. Another program was more for wider Ukrainian refugee community, and we have provided, we've been providing, and we are doing it still, psychosocial support through schools and libraries, and I will show you how in a minute. And another program is, as I have mentioned, we prepared for unaccompanied minors who are crossing irregularly the Belarusian border, and we are starting it now, in fact. The case management also program, psychosocial support and individual support for the children who cross and then are placed in Polish foster care or in centers for foreigners. So now I wanted to play a short video. Oh, we don't have voice.
Czuję się po tych zajęciach mega fajnie. Myślę, że pomogło tu się nam troszeczkę bardziej zgrać.
Tutaj dotykamy tych sfer bardzo ważnych, czyli emocji, asertywności, komunikacji, poradzenia sobie z agresją.
Wspieramy ich taką integrację i to, żeby zbudowali wsparcie między sobą wśród swojego towarzystwa.
Wszystko się podobało.
Wszystko się podobało. Sorry, it was only in Polish because it's a very fresh and short film. I just wanted to show you, you know, a glimpse into the alternatives for online, because this is, I think, what I think we should focus on, not only to ban online, of course, but to propose alternatives. And what we do is we provide psychosocial group programs. One is called Team Up and the other one is called Heart. They have been created by a few international agencies such as War Child, but also with support of UNICEF. And we also train teachers and adults working with children in psychological first aid. So basically very basic active listening skills, I would say. And also we have a peer-to-peer support project, which is called I Support My Friend. And we are training teachers to train their students to be peer-to-peer supporters. And I just wanted to say a few words more about three of those programs. One is HEART, as I mentioned, which stands for Healing and Education Through the Arts. And here, what are the healing factors? I think the factors that are not present in online, you know, so the true connection, non-judgmental approach. This is I would say, the most important guideline in this program, because basically the program consists of the series of art activities that are proposed to children by trained facilitator, which has a sense, I would say, which develop with time. And it is regular, It has a rhythm, internal, I would say, rhythm. It is structured. It promotes relation within the group. It promotes free expression, but also sharing emotions. And it happens in a safe environment, without judgment, without pressure, and so on. And we are focusing very much on the process, not on the product. So the children feel really safe. They do not feel judged. So we are training facilitators who then, through schools or through libraries, are working with children. Another one that I mentioned was, yeah. I'm sorry. Okay, I will speed up. So another one was team up. So this is a movement-based approach, which is which speaks the language of the children. Yeah, play, movement, relations. As I said before, rhythm, creativity, sense of belonging, and but also the exercises tackle different themes. So if the facilitators see that in the group there is a problem with bullying, for example, he or she has special exercises and activities to tackle this problem. So here we can find also those healing factors like, you know, relation, like structure, like safe adult, safe, same space, you know, the type of, how to say, repetitive, rhythmic activities. And all the sessions, both for Team Up and Heart, have internal structures. So we are teaching children relaxing activities, relaxation activities, and after that they have the main activity and they can share what they have learned, what they have felt, and so on. And the third program I mentioned before, I don't know what happened, but it doesn't matter. I don't know what happened with the one of the slides. But just finishing, which is called I Support My Friend. So, oh, it's there. So here, in my opinion, the most important factor is to give sense of agency to the children. Because, you know, in different approaches and programs for youth, we are treating them as an object of our activities. And here, somehow, we recognize that they are resourced, they can be active, they can be active subject, and we are teaching them how to support each other and also following the guidelines and following the support of safe adult. In most of the cases, those are teachers. And of course, we are paying attention not to give too much of responsibility to children. So this is safe. Yes, so I feel that I need to stop now because we are probably hungry, but I can invite you to see our website, of course, and contact us and discuss during the breaks. There is also my colleague Francesca from Save the Children, so we'll be happy to discuss if you have some questions or remarks. Thank you.
Thank you very much. This was the summary of the projects, very interesting one. So we really encourage you to look at the website and talk to the ladies about how to do such project, how to do such intervention, especially that they were focused also to adults, to caregivers, but also directly to youth. And this will be a very good introduction to the youth project and also school-based project, but youth for youth, we can say. So, girls, the floor is again to you, so have your time. We are waiting for the dinner, but it for sure wait for us, so don't hurry and feel safe and have a good moment.
Good morning. First of all, we want to thank you for the opportunity to appear here and speak on such important topic as mental health. We represent Piotr Skarga Secondary School in Pultusk, and we would like to introduce ourselves. My name is Julia Piecychna.
And my name is Magdalena Kowalska. Presentation of mental health promotion project in a screen-dominated world organized by IF for young people, titled One Smile Please. Project implemented as part of the Olympiad Zwolnieni z Teorii. Today we would like to give you an idea of what our project is about. But first of all, Zwolnieni z Teorii is an Olympiad for young people who, under the supervision of teachers and tutors, carry out social activities related to their passion and interest. By completing the project, we have gained skills needed in the labor market, learned management, teamwork, and got certificates helpful when looking for a job.
Can we help for next slide? For a long time, I have been dreaming about making a social project. And finally, after a long time, thanks to my friend, I could make my dream come true. We have seen that a lot of young people feel alone with their problems and don't know how to deal with them. We want to help people, but most of all, show them that they're not alone. As we can see here, there were 4,845 suicides in Poland in 2024. That information is big, but those numbers are not only numbers, but real people who can be members of our family, friends, or people that we see in the street.
The mental health project focuses on spreading knowledge and understanding of aspects of mental health, such as depression, anxiety, stress, and effects of prolonged exposure to ridicule and negative comments. Mental health has a huge impact in our daily lives. Our relationships with others, our ability to cope with stress, or our overall quality of life. The project aims to dispel myths surrounding mental health problems and promote an open approach to talking about emotions. The project aims to raise awareness that talking about one's feelings, emotions, and help is a sign of courage, not weakness. It also shows that mental health is just as important as physical health.
The target groups of our project are mostly teenagers, but also children and adults. We want to be universal because mental problems can concern everybody, regardless of sex or age.
The project aims to make sure that the essence of mental health is not overlooked in public space, but exists in everyone's mind. The project aims to educate people on how to recognize the symptoms of mental disorders such as depression and anxiety. The aim of the mental health project is to raise public awareness of the importance of mental health, promoting openness in talking about emotions and difficult experience. We also show how a person struggling with mental health difficulties can be helped and where such people can see support, helplines.
Here we can see the methods of promoting mental health. Firstly, we can try to educate our family or friends. We can just sit together and start a conversation with them. Another method that we personally recommend is to do a social project. Maybe it seems scary, but the satisfaction that we can really help people is more worth than anything else. The third idea is to educate yourself. We don't have to be a doctor, but the basic of psychology can have an amazing impact on our life. Perhaps we could learn something that would change our life.
As a part of the project, we held a number of events. Some of these you can see on the photos. We held a meeting with officers of the district police station in Pultusk. Students of our high school could learn about the specifics of police work in relation to mental health. We held a workshop in primary school. For younger children, we prepared activities about emotions and feelings. For older, about depression, its symptoms, treatment, and how to help people suffering from depression. What is more, we ran educational lessons on depression and hate speech for our high school students. We also performed at parents' meeting where we showed what depression is and what its symptoms are. Our project has been appreciated and we have gained several patronages. Honorary patronage of the district head of Pultusk, Jan Zalewski. Honorary patronage of the mayor of Pultusk, Beata Jóźwiak. District police headquarters in Pultusk. A public primary school named after Polish-Hungarian friendship in Przewodowo-Poduchowne. And Piotr Skarga Secondary School in Pultusk.
Here we can see positive effects and negative on the internet. Teenagers in the era of social media experience a mix of positive and negative emotions. The internet connects them and allows self-expression, but it also brings pressure, anxiety, and comparison. The first one is connection and belonging. Teenagers stay in touch with friends and find communities that share their interests. Self-expression. Platforms like TikTok or Instagram allows them to showcase creativity and talent. Learning opportunities. They access educational content, mental health resources, or for example, global news. Support networks. Some online groups provide emotional support, especially for marginalized teenagers. Now we're going to focus on the negative effects. And the first one is comparison and low self-esteem. Seeing perfect images online can make them feel inadequate. Fear of missing out. Constant updates from others can make them anxious about missing out on experiences. Cyberbullying. Negative comments and trolling impact self-confidence. Addiction. Excessive screen time can disrupt sleep, concentration, and real-life relationships.
How to maintain a healthy balance. Limit screen time. Set limits for social media use. Follow positive content. Engage with uplifting and educational pages. Take digital detox. Breaks from screens help mental clarity. Talk about feelings. Open conversation with friends or family about online experience. We try to follow these points, but it's not always easy because, for example, we run the project online. But we know that these presented sub-points would be very good for our mental health.
To sum up, mental health is important for how we feel, think, and get along with others. It helps us handle stress and deal with life challenges. Taking care of our mental health through rest, support from others, and self-care makes life better. Talking openly about mental health can encourage people to seek help when needed. And that's all what we wanted to say. Thank you for your attention.
It was great summary of all the topics that we mentioned today. I would be brilliant and just in line with what was here discussed. Also, we have a great recipe for what to do and for what to do for adolescents. So I think the main issue that you mentioned, that you had the satisfaction from the project that you have proceeded. And I think this is very encouraging to all the policymakers, all the experts, all the people around this table to take advantage from youth participation and invite you to the policy development and all the programs and intervention that are targeted to adolescents. But last not least, I absolutely not forgotten about Olga. Olga, the last words to you.
Ladies and gentlemen, in today's increasingly digital world, social media platforms have become an integral part of young people's daily lives. Apps such as TikTok, Instagram, Snapchat are shaping the way young people see themselves and others. While social media offers a space to be creative, express themselves and build community, their impact on young people's mental well-being and body images is increasingly a matter of concern for experts, parents and teenagers themselves. Firstly, let me say there are unrealistic beauty standards and pressure to look perfect. One of the most disturbing aspects of using social media is the promotion of unrealistic beauty standards. Many young people compare themselves to influencers or celebrities who present a perfect look, often achieved through filters, photo editing apps, and professional graphic editing. This comparison leads to a decline in self-esteem and the sense that one is not meeting social expectations. The widespread use of filters, such as on TikTok, Instagram, and in apps like FaceApp, makes many people blur the line between what is real and what is digitally generated. An example is the controversial chubby filter on TikTok. By changing users' facial features, suggesting that a bigger body is the reason for jokes, it was met with harsh criticism for promoting fat phobia and body shaming. In response to negative reactions from users and experts, TikTok removed this filter from its app. What is more, the problem is the obsession with filtered looks that people transfer into real life. The term Snapchat dysmorphia describes people who have become so used to the filtered image that they begin to seek surgical modifications to their appearance to resemble the version of themselves on the app. Young people begin to believe that only an enhanced version of themselves is acceptable and worthy of showing to the world. This leads to a serious mental health problem, such as anxiety, depression, and eating disorders. Another problem is the influencer culture, which creates pressure to be perfect. They play a key role in shaping beauty standards and trends in social media. They often show the perfect lifestyle-body relationship, all infused with the aesthetic of success. Young people, unaware of marketing and peer campaigns, absorb this content without thinking. Comparing themselves to these images, they may experience low self-esteem and dissatisfaction with their own appearance. A positive example in fashion world is Brazilian designer Caroline Vito, who celebrates body diversity in her collections. Her work highlights natural body shapes, promoting inclusivity and self-acceptance. In summary, social media, including popular platforms such as TikTok, Instagram, Snapchat, and other apps, have a huge impact on the lives of today's youth. On the one hand, they offer a space to express themselves, build a community, and access a wide range of educational and entertainment content. But on the other hand, their negative impact on mental health, especially in the context of body image, is increasingly visible and worrying. We, I mean the teenagers, are particularly vulnerable to the influence of social media. Comparing ourselves to idealized body images presented by influencers, celebrities, or peers leads to low self-esteem and can also lead to eating disorders, depression, anxiety, and other mental health issues. Filters, photo editing apps, and unhealthy competition for the perfect look result in seeing ourselves unrealistically, and striving for the impossible becomes a cause of internal crisis. Promoting natural look in social media, media education, and support from the adults to are essential to minimize the negative effects. It is also important that tech companies are held accountable for the content they share and that they work together to create a healthier online environment. Thank you so much.
Thank you very much. Just quick summary that I think that all of us gain so many information. We were not aware as a scientist for sure. We are always 2 or 3 steps behind you. So thank you very much for those insights. We are taking them into our hearts and into our research for sure, and to call to action projects, because we need to change these negative trends and we need to make it together. So experts, thank you very much. Professor Grabski, Dr. Anna Dzielska, Król Jankowska, Dr. Tomasz Strebnicki i Joanna Hajduk, Katarzyna Szymielewicz też z nami. Bardzo, bardzo dziękujemy i dziękujemy młodzieży. Będziemy starać się współpracować, żeby zmienić te negatywne trendy. Thank you very much and let's go for a dinner.